All right, take 20. All right, we are going to do a manual muscle test of the extensor digitorum brevis. And Adonis will be my patient. And for this sitting position, I want him in a long sit because that allows me to test hit the extensor digitorum brevis against gravity. So for step one, I'm going to stabilize his metatarsals. And then I'm going to put his extensor digitorum brevis against gravity and ask if he can, or see if he can hold that. Adonis, can you hold this? So him holding that would automatically be a grade of 3 on the manual muscle test. Now I'm going to apply resistance, and I'm making sure I'm going to press on the proximal phalanges because that's as far as the muscle runs up to. I'm going to press for 3 to 5 seconds. Ready, Adonis? Hold, 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 hold. All right. And I applied strong pressure, and he held it the whole time, so he got a grade of 5. Next, we're going to do the extensor hallucis brevis. And Adonis is already in the correct position for the test. So first, I'm going to stabilize his first metatarsal, and I'm going to put his hallux in a position against gravity. And Adonis, hold this position. Great, so it's automatically a grade of 3 on the manual muscle test. And then when I apply resistance, I want to apply it to the proximal phalanx. And I'm going to do that for 3 to 5 seconds. You ready, Adonis? Don't let me move you. Hold, 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 hold. And I applied strong pressure, and he held it the whole time, so that's a grade of 5 on the manual muscle test.
We're going to be measuring active range of motion of the first metatarsal joint. So the axis is going to go at the medial border of the first MTP. The stationary arm is going to go on the medial border of the first metatarsal. And the movable arm is going to go along the medial border of the proximal phalanx. So I'm going to be stabilizing the first metatarsal and making sure the patient keeps his IP neutral, so not an flexion and not an extension. So I'm going to stabilize the metatarsal, and I'm going to ask you to bring your toe into extension. Hold that position right there. Now I'm going to put the axis at the medial border of the MTP, lining up the stationary arm with the first metatarsal and the movable arm with the proximal phalanx. And I'm getting a measurement of 60, and the normal value is 70 degrees.
Now we are going to do passive range of motion of his MTP joint. We are going to be testing flexion. So, to measure this, I'm going to be stabilizing at his metatarsal, and I'm going to put him into MTP flexion. So by doing this, I can hold it right there, and I can place my fulcrum at the MTP joint. I can place my proximal arm down his first metatarsal, and I can place the distal arm down his proximal phalanx. Doing that, I'm getting a reading of 45 degrees, which is normal.
So we're going to be doing a posture assessment for Jeff's feet. So we're going to start with an anterior view. If you look at the plumb line, it's going to be right in between his feet. From this angle, we can see the medial longitudinal arch of Jeff's foot. And you can see he has a slightly normal, maybe possibly pes cavus, medial longitudinal arch. If you look at his toes, he has a slight valgus angle of his distal phalanges. So we're going to change Jeff to a lateral view. We're going to line up the plumb line right anterior to his lateral malleolus, and this should be slightly anterior to his knee joint. And you'll see that it lines up perfectly on there, so Jeff has good posture of his lower extremity. And now we'll transition over to a posterior view. And from this posterior side, we'll be looking at the angles of Jeff's calcaneus. And you can see he's pretty much straight up with his calcanei, which will lead to good posture. And also we're going to look at Jeff's toes. From this angle, we could see about 2 of his outside toes, and that's good posture. If we could see any more, that would be that he is out with his feet. If we could see less, he would be toed in. And so Jeff is pretty much good there.
Extensor digitorum. We're going to do our manual muscle test.
The stationary arm.
And Adonis, can you hold this, please? Oh, you didn't hold it, so